Morning, my name is Ruth Beecher. My job title is Service Manager Early Help for Families, but somewhat paradoxically, I'm also the Council's Troubled Families Coordinator. And that may seem like a contradiction, but actually it links very closely to our strategy around supporting families, because if you don't provide early help, we have a new set of troubled families of tomorrow. So maybe not such a paradox. I've been asked to come and talk to you today with Anisha from PACT about partnership and innovation. And that's in the context of how we engage, support, and challenge families. And that challenge is very important, and it's something we're trying to put together with the support in a way that perhaps we haven't done before. So local public services are often criticised. They're criticised for being too fragmented, too bureaucratic, driven by those sorts of bureaucratic structures rather than what works for our residents and what works for families. And we have been a community-based budgets pilot in Islington, set out really to make a difference for families with multiple needs. And that's by working differently. Community-based budgets is not a thing, it's not a service, it's a way of working, and it does lots of the innovative things that colleagues have been talking about in the videos that you've seen before. And we have to work differently in the face of the sort of funding challenges that we've heard about and the kind of changing policy agenda that we have from government. But we also really want to do this because to make Islington a fairer place for families to live in the context of what's going on with welfare reform and the funding situation, we have to work differently. So we've got two strands in Islington, and I'm really proud to work for Islington Council because in Islington our members have made a commitment to early help for families in the context of huge cuts to our funding. Many other authorities haven't done that. So that's something that is really good and something for us all to be proud of. So we've prioritised early help for families, and we've created a new service for families with school-aged children. So early help means basically getting to families early, nipping problems in the bud, making sure problems don't escalate, because when they do, they cost many millions of pounds more to fix. We also have troubled families. I think you may all have heard of troubled families. David Cameron and Eric Pickles talk about them a lot. These are families who cause a lot of problems and have a lot of problems, is the message we're getting nationally. They're families who are in major difficulty. They're involved in crime and antisocial behaviour. Their children aren't getting to school every day. They're on benefits often. There may be violence in the family or with family members in the community, substance misuse, mental health. Shall I go on? Maybe not. But they cost services a vast amount, but they also have a cost for the children and adults in those families, for their neighbours, for their wider community. And their problems generally come down through the generations. So many of the parents who are criticised for not being good parents have not had a good experience in life themselves. They may have been abused or neglected or not parented well themselves, grown up in poverty, and in a family where crime and antisocial behaviour were the norm. So it's not a simple problem, even though it's sometimes presented to us in that way. And within troubled families, colleagues in many departments will be hearing about payment by results and starting to grapple with what that means for us in public services. And troubled families also comes with a payment by results. So it's a new way of working, it's a new challenge in how we think about families. So we are trying to balance that early help to families and not lose that with really reaching out and challenging and supporting those who have multiple and very complex needs. And it's a fairly challenging agenda, which is why I look very tired this morning. But what we've tried to do is base what we're developing on what we know from research works with families. So evidence-based practice. And what works with families are some very simple things that you may all know. It's a core offer of services, so being very clear about what you're going to deliver and why you're delivering it. It's using more than one method of delivery. So we've heard about different ways of doing things across the departments, but with families that might be home visiting, group work, guided learning as part of a package, but you need to be very clear of the evidence base for that. It's about partnership working. It's about a can-do, will-do culture from the staff, from the partners, with the families, and knowing that that will make a difference for children, so demonstrating the outcomes. And it's also about assertive outreach to families most at risk. And where we do that really well in Islington is, as well as getting out there, knocking on doors and refusing to go away, we also use our data really, really well across our benefits data, our adult services data, our children's services data, so that we can get out there and offer support to families. And that's something that many authorities really struggle with. So, what are we doing? In the past, service delivery to families was fragmented. Now, who here is not a member of a family? Nobody. Most people go to certain areas to get advice and support when we're in difficulty. So, if the first person you would go to is a member of your family for help, put your hand up. Many people. Some of us are estranged from our families. What about who goes to friends first for help? Lots of people. And the list, as you go sort of along the list, tends to go families, friends, a health visitor if you've got young children, GP, somebody at school, your local housing office, your local kind of community or voluntary sector group for help. And in Islington, we've been really lucky. We've got a lot of those, and a lot of them are very, very good. But I suppose the downside of that is if you're working as a GP or a teacher or a housing officer, you might know many services, you might know no services. It's quite a puzzling picture sometimes of knowing where to get help for families. And we had a core service for children under 5 and their families through our children's centres, which have really made great strides in the last few years in reaching out to the most vulnerable families. But we didn't have a similar service for school-aged children. So community-based budgets has helped us, and we've been able to redesign services so there is a consistent core offer of services for families with school-aged children if they have additional needs. And they work together with the children's centres. And research tells us that what's really important with the most vulnerable families is having a trusted relationship with a key worker. Vulnerable families don't respond well to 16 people inviting them to a meeting and telling them what they're doing wrong in terms of parenting their children or why they're being evicted, etc. So that is a feature that we've been able to offer across the core services, a key worker to support the family, but also to challenge them, to say, if you do not cooperate with us, you will be evicted within 6 months. So there's some very plain messages have to go to families as well. So on the individual level, what we do is we draw other services in around the family rather than referring them on. The most vulnerable families get lost when you tell them to go to the income maximisation service to get advice about what's going to happen to them next April when the benefit cap comes in. They don't go on to other services. But there's also something different that we've done on the strategic level. So in terms of when we're commissioning services, developing them, trying to decide what works better, we're trying to do that to build on our core offer of services. We're not going to commission a bit of PACT, do a bit of prison work over there on their own, and a volunteering organisation to do a bit of that over there. We're trying to pull them all in together and say, you must work with our core services. This is what works for families. And I suppose the really important thing to say to you today is, this is not a message for children's services managers, because the majority of us as managers in the council work with families. Even those of us who are working with single, vulnerable adults have connections to their family. Even if they are very estranged, what is going to help them to build resilience and move on is those networks. So we are all part of a family, and we all have to find different ways of moving out of our silos and working together to engage and wrap services around families. So whether that's on an individual team around the family or on that strategic commissioning level. And Councillor Green talked about the challenge of welfare reform. And I think that's a good example of where we've got a really thorny problem and we're trying to work together across departments to make sure that large families with multiple and complex needs can move towards work and that we can support and protect the most vulnerable children in those families. So the service I'm here to talk to you about today is Families First. This is a new service for families with school-age children, and it's been built in partnership from the beginning. So we've got Children's Services, Family Action, Parent House, IMICHE, CSV and PACT. Lots of organisations bringing different expertise into the mix, but delivering that core offer. And since we started in April, we're building other concrete partnerships. So we have a pilot scheme with detached youth work to see when they're working with young people, can we back that up with family work to make more of a difference? We've got a partnership with the GPs to see if we can work in a more systematic way with them and with child and adolescent mental health. Child and adolescent mental health services. And we've got 3 teams, they cover the whole borough. It's an open access, non-stigmatising service, but we do use our data to try and reach those families who we know have got lots of difficulties. Debt, worklessness, risk of homelessness, mental health, substance misuse, behaviour at home, in school, in the community. And again, Councillor Greening talked about volunteers. CSV, who are in that partnership, have brought on over 20 volunteers to support families since April. So they're doing really well. So I'm going to talk to you really quickly about what Families First does, because talking about it in the abstract is not very helpful for you. So the service visits families at home, supports them to set small goals so that step by step they can make positive changes, sort out their debt, make their home safe and warm for them and their children, get their children to school on time every day. They sound like very small things that we all manage day to day, but many families struggle with those and it gets them into more difficulties. We've got a really strong partnership with Islington Learning and Working. You saw the BEST team there, and with Job Centre Plus, which is very new and is going very well. We do parenting programs, they're evidence-based, they're internationally evaluated. We do our door knocking, and we try and build partnerships with the police, community safety, and colleagues working on the ground so that we can engage families who are in difficulty. But what we wanted to talk to you about today was one of our partnerships in a bit more detail. So I'm going to hand you over to my colleague Anisha Mehta, and she's going to talk to you about a very particularly vulnerable group of families and how we are working together with PACT to engage and offer support to them.
Okay, good morning. My name's Anisha Mehta. I'm an integrated family support advocate, and I work as part of an integrated family support pilot that's funded by the DFE and NOMS. And NOMS is the National Offender Management Service, so the umbrella organisation for prisons and probation. I work in partnership with Families First in Islington and the Community Safety Partnership. And the purpose of my role is to raise the profile of children of prisoners and to raise awareness of the support needs of families where a significant adult is imprisoned. So I'm just going to start with some facts. There are 200,000 children with a parent in prison, and this is just an estimated figure. It's thought that the actual figure is a lot higher. And just to put that in context for you, that's more than the number of children who are looked after, and it's more than the number of children who are affected by divorce of their parents. 7% of children experience a parent in prison during their school years. 25% of men in young offenders institutions, so where they're serving custodial sentences, are fathers or expectant fathers, but these will be your sort of 18 to 21-year-olds. 5% of children remain in the family home when their mother is imprisoned. So that's quite a stark figure, really. 95% of these children will move to live with kinship carers or be taken into care. And often that move of family home also means that they're moving school and losing their peer group support. And over 60% of women prisoners are mothers. 45% of them had a child living with them before imprisonment. The policy context for this work is informed by the Children of Offenders Review. And what this review found was that the children of prisoners experience poor outcomes and negative consequences. And they will be things like very high levels of engagement with antisocial behaviour or criminal behaviour, more likely than their peers to experience mental health problems, behavioural problems at school leading to exclusions, bullying, teasing, unstable care arrangements, a lot of financial instability in these households, lots of housing disruption, and all of that exacerbated by the sort of cost of trying to maintain contact with the parent who's been imprisoned. The review also found that there is no system to identify these children, so they're an invisible cohort, and there are many reasons for this. Helen Codd, who's an academic at the University of Lancashire, talks about a culture of secrecy around imprisonment. So often families are so affected by the sort of shame and stigma that they don't come forward to ask for support. And also very often children are either not told the truth about where the absent parent is, or they're told the truth and told not to tell anybody, so they can't access any support. So there's no systematic support or standard of support. So an example of that would be that some schools have a really good protocol in place to support children whose parents are imprisoned, and other schools will have no starting point on this agenda at all. And imprisonment doesn't trigger an automatic needs assessment, so these children don't automatically become Section 17 cases. There are key risk points for children who experience parental imprisonment, and these are arrest, conviction, imprisonment of their parent and while their parent is serving, and on release. And what it's found is that, what the review found was that earlier intervention that coincides with these key stress points is crucial. What we tend to do as agencies is we firefight, so we intervene when a critical stress point is reached, and our interventions are short-term and made in isolation, so we need kind of better timing in terms of our interventions. So an example of this would be that a parent is arrested, the offence is detailed in the local media, the children experience bullying or teasing at school, and then the school intervenes to do something. One of the other key findings of the review was the sort of timing of how long we work on cases. So actually closing a case at the point of the parent's imprisonment is not an effective way of dealing with these families' needs, which will manifest themselves after the imprisonment has happened. So if we close our cases, we leave these families with many unmet needs. So I just want to talk to you a little bit about the pilot that we're developing in Islington. We have developed a model of working around the offender's journey. So that's everything from arrest to the court appearance, serving sentence in custody, to release. And at every point of that offender's journey, what we're trying to do is identify points at which we can intervene to offer support to children and families. So what we're relying on is criminal justice agencies identifying families who need support, and then targeted and specialist family services actually making the offer of support. And the reason why this model is significant is that although there's a strong correlation between parental imprisonment and poor outcomes for children, research doesn't prove a causal link. So if we intervene at the right time, outcomes can be improved. In terms of this model, what we're trying to promote is joint working relationships. So it's real kind of matrix working. We're working right across boundaries. So that's the Community Safety Partnership, prisons, London Probation, the police, and family services at Islington Council. So we're really kind of looking to push the integrated working agenda, the use of the common assessment framework, so that we're intervening before crisis point is reached. All the interventions are consent-based, and what we're hoping for is that referral pathways are one step and linear, so practitioners only have to do one thing to make a referral, and they can focus in on the meaningful work. They're not kind of prevented from doing this by kind of layers of bureaucracy. And what we're hoping is that every contact with the offender or the family counts, so that nobody assumes that someone else has already done something. Just to illustrate this for you, we had a case in Islington very recently of a mother who was charged and convicted of drug offences. She had two children, a 2.5-year-old and a 10-year-old. We had a very progressive Crown Court judge on the case who indicated that the mother would receive a custodial sentence of between 1.5 and 3 years. But he deferred a sentence so that arrangements for the children could be finalised. And what this allowed us to do was to have discussions with the mother about who she was going to nominate to look after her children while she was serving this custodial sentence. And she was able to say that her mother would step in and look after the children. The maternal grandmother was known to a local children's centre where she often visited with a 2.5-year-old, and there were no concerns about her capacity to care for the child or the children. Contact was made with the 10-year-old school, and they were able to put counselling support in place. Families First were able to call a team around the family meeting, and we were able to get a family support worker from Holloway Prison there who was able to offer mum some practical support and just help her with things like booking a visit with her children as soon as the mother came into custody. And again, you know, the really good thing about this is that all the key agencies are linked in and talking to each other at the earliest possible point. So I'm going to hand back to Ruth. Thank you. Yeah.
Okay, so just to summarise, we wanted to demonstrate today how we were using a concrete partnership in a very real way to make a change across many organisations in this case. And a key thing for us has been to understand how each organisation works in detail, in practice, on the day-to-day level. So not to ask court officers, for example, to do something very bureaucratic during the day in a busy court to make an offer of support to a prisoner for their family, but to talk to them about how they work, how they could adapt their work processes, and not make extra work for them. And I think another important thing that Anisha has demonstrated today is about the importance of providing evidence that working together can make a real difference to the outcomes for each individual agency. Each agency has to understand what they will get from working in this new way. So she's shown outcomes that affect housing officers, the police, health services, schools and prisons through the statistics that she's provided. And also she's shown that there's potential to save a lot of money, which these families do use in specialist high-cost services if we don't intervene earlier. And I suppose the last thing just to remember is that we've tried in this process to respect the privacy and confidentiality of individual children, young people, their parents, not to pass around information without consent, and to build that into each part of the process. So I would just end by really encouraging all to think child, think parent, and think family. Thank you.
Very big thank you to Ruth and Anisha, who very modestly failed to say that what they've built here is the phoenix that rose from the ashes of the 27 million that we had to save in children's services over a period of time, and many of the individual and discrete services that now make up this new Families First team were reconstructed. We learned from what we'd been doing and we brought them into this new team. And so we've now got something that I think is much better than what we had 2 or 3 years ago, even though we've got far less resource. So that's a really key part of this innovation. And that innovation happened from managers like you. It didn't happen from people like me.